a rupture of the frontal branch of the middle meningeal. Normally, one wouldn't be exposed to this technique in a hospital like ours. Modern surgeons are becoming more and more specialized. In my day, we were trained to turn our hands to anything.
Well, that's what I'm here to learn, Mr. Docherty.
Hi, good afternoon, Adrian. Busy day?
Oh, nothing special. How's your motor running, Mr. De Vries? Oh, my God, the jag!
James.
Hi. Well, actually, I think that's all we've got time for. Thank you very much. Mr. Docherty, I was wondering, would you have time to pop into my office this afternoon?
Well, I'm already late for clinic. Can we talk in a way?
As you wish.
Good news! Mr. Smedley will explain.
I assume you've seen our advertisement. Another consultant will provide new blood for the department.
There's not enough theatre or clinic time to support a new consultant's workload.
I'm sorry, Mr. Docherty. I'm doing the best job I can.
I had imagined I was a surgeon whose experience was still of some value. Obviously, I must now conclude that I have become one of those old duffers who so amused me when I was a youngster. Seems a lifetime ago now.
I get no pleasure from this, Mr. Docherty. I am charged in a small way of shaping an efficient health service. And that means letting go of some of the old values. A consultant will soon no longer have a job for life. Doctors will be paid commensurate with their performance. Those who don't perform will be replaced. And that is no different from the terms under which the rest of the world has to work.
I shall make plans for early retirement, Mr. Tennant. I can only hope I've been of service to my patients, a guide to my juniors, and not been a burden to my colleagues.
Catch you up, guys. James. You've been acting as though I hadn't told you I was going to be here today.
I'm sorry.
You are still on for tonight, okay?
I don't know.
Look, if you don't want us to see each other anymore, just come out with it.
I just don't feel like going out tonight. Maybe I'm coming down with something.
Well, you should know.
Yeah, I suppose I should.
Look, I'll call you sometime, okay?
Okay.
And you're adamant you can't remember a thing?
I can't even remember my own name.
OK. All right, well, we'll get a doctor to see you shortly. You're going to like this one, complete amnesia. I'm checking the details now.
I don't believe it. It is you, isn't it? I've got all your albums.
I honestly can't remember a single thing about myself.
What about the groupies? 10 a night, they say.
Do they?
Is it true what the page 3 girl says about the size of your, It is! I knew it! Look, can I have your autograph? Oh, sorry, when you remember.
OK, so your name is Desmond Frimp, you're a chartered accountant, and, you live with your parents. OK?
Hello, Stephen. Where's your mum? How's your big bag there?
Yeah.
I used to be a bit of a rugged man myself. They always used to say control was the thing. Stop the ball, find your man, get him. Side of the foot. Yeah. Whoop.
Do you really cut people open?
Well, sometimes it's the only way to make people better. Why? Too gory for you, eh?
No way. I think it's great. Hope I can do that when I'm older. All time, final whistle. Do you want to go and open the car for me?
Oh, Mum. Stephen, just do as I say, please.
Oi. He's mine, isn't he?
No.
I don't believe you.
Just believe it and leave it at that.
Don't worry. The doctor will be with you in a minute.
Hello, I'm Dr. Raja. What happened to you?
I fell off a roof.
How does your foot feel? Dead?
He's had 75 of pethidine.
We're going to put this fracture back in place, I'm afraid. Would you like to apply counter-traction?
Doctor?
Yes?
I think you ought to know I'm HIV positive.
Is there a problem, Charge Nurse Garden? Let's do our job, shall we? How does your foot feel?
Better.
Good. Let's put it in a back slab and I'll do a form for an X-ray.
Railwaymen and French air traffic controllers strike. Junior doctors don't.
Any idea where Dr. Yates might be?
Yeah, I'll be starting his outpatients in about 15 minutes. Dr. Maitland, RMO.
You go through all the proper channels, you know. You're off. See you later. It won't make any difference unless you've got the support of your consultant.
If word gets out, no decent hospital would touch you.
I'm just having a few minutes for my lunch. I don't think that's asking too much out of 32 hours without a break. What kind of people are we that we just stand by and let it be done to us?
Bullied, beaten, scared people. You know, I've got the beginnings of a career in a profession to which I'm dedicated. I've also got a wife and a mortgage and a consultant who's already threatened to blacklist me on the old boy network if I don't toe the line. Not so long ago, it was you who advised me not to start a fight you can't win.
Yeah, well, the stakes have changed.
Your precious Dr. Maitland certainly hasn't pulled any punches, Graham. Management repeatedly warned. Intimidation of junior doctors who spoke out. 31-year-old man with wife and 7-year-old daughter dies in A&E owing to lack of trained staff.
She hasn't named him, has she?
No.
At least she had the sense not to breach confidentiality.
Graham, focus. The repercussions are going to affect more careers than hers. Impinge on more resources than we normally command and interfere with patient care in fields wider than just out-of-hours ENT.
She must know that going this far over the line means there's nothing I can do to help her. What a waste. I never thought she'd be so foolish as to throw away such a promising career.
Well, like as not, it's missed the vital organs. Should be okay.
Bit of a nasty splinter. Sorry to bleep you over such an iffy one.
No props.
Some old Doris has coughed up about a teaspoonful of blood, normal gases in chest X-ray, cubicle 3.
We'll admit her for investigation.
Are you going to see her yourself?
Can't be arsed, Raj, mate. I'll go and tell her we're going to keep her in. Dr. Maitland, RMO.
Thank you for seeing me, Dr. Yates.
Right. What can I do for you, James?
I've noticed a Kaposi's sarcoma on the roof of my mouth.
Well, let's have a look then, shall we? Have you ever had your HIV status checked?
Not for 5 years or more. It was negative.
Well, I'd like to do the test again, please.
Okay.
And we may as well do your CD4 count while we're at it. Since oral Kaposi's, it'll be an AIDS-defining diagnosis. Any risk factors?
I'm bisexual.
Right. Prick in your arm. Nice change for you.
Keep still.
Off legs? No, no, no. Send them up immediately. Bye-bye.
I'm not here to wag my finger, Claire. You did what you thought was right. But you know I can't let this go.